Hello, this is Dr. J. Hartley at the Hartley Chiropractic Scoliosis Center in St. Augustine, Florida. And today we're going to be talking about carpal tunnel syndrome. Carpal tunnel syndrome is a pain usually in this area associated with numbness. And patients can get all kind of crazy symptoms, numbness, weakness, just inability to use their hands properly. Surgically, they'll come in and they'll cut this ligament right here and make a little extra space, and then sometimes those symptoms go away. The symptoms most commonly are nocturnal or symptoms when you're sleeping at night, numbness through this area. Usually within about 2 years, that area that they cut that ligament, it'll fill in with scar tissue, and a lot of those original symptoms will come back again, and you can't cut that ligament twice. So it doesn't necessarily get to the cause of the problem. So there's some specific exercises that we've had good results with over the years that we're going to go over. First and primarily though, I want to go over the cervical spine. If you have a misalignment in your neck affecting the nerves of C6, C7, T1, then they can be a major influence of carpal tunnel syndromes. So the first and most primary thing is you want to make sure your nerve roots are freed up, you have the best cervical curve possible, and the best alignment in your neck possible. Now let's get to the wrist. So when there's an imbalance in the wrist, usually what happens is there's tightness in the front of the forearm, okay, or the flexors, they're too short. And then in the back here, there's atrophy. And that is associated with misalignments in your neck. When you have subluxations or nerve interference in your neck, it very commonly causes spasm in the anterior of the wrist, weakness in the posterior of the wrist, atrophy here, okay? And that creates a lot of compression in this tunnel here, what we call the carpal tunnel. So there's a stretch we do to open up the tunnel. And what you do is you put your wrist, your hands flat on the table, keep them flat, and then you bend back, and it opens up that tunnel. You'll just hold that position for about a minute. You'll really feel that stretch. If you get pain, then you want to stop and consult with your chiropractor ASAP. So that's going to stretch the flexors of the wrist. Okay. The other thing we need to do is we need to strengthen the posterior muscles of the wrist, or the extensors. And we do that two ways. One, we use this high-tech piece of equipment known as a rubber band. You could also use a hair tie. And what you do is you just open up the fingers like this. And so it's working the extensors of the fingers, the wrist, and the whole posterior arm here, right? So now we're stretching the ones that were too tight, strengthening the ones that were too loose. Now the more advanced exercise is an exercise that's common with baseball. You'll see them use a broom handle. In this case, we're using PVC and a weight, and you just rotate with your wrist this pipe and bring this up, okay? So you can bring it, lower it down, and then you'll bring it back up. And this is strengthening the posterior extensor muscles of the wrist. And guess what happens when you strengthen extensor muscles here? There's something called reciprocal inhibition, and it relaxes here, okay? So it all kind of works together. So if you do that exercise and then you go back again and do this stretch, you're gonna find that it's easier to do, because when you contract it here, you relaxed here, and all of a sudden it's starting to open up this tunnel. So if you have more specific questions about this, you can let us know at Hartley Chiropractic and Scoliosis Center in St. Augustine, Florida. This has been Dr. J. Hartley. You go out there and make yourself a fantastic day.